You're listening to the Tony Conley Morning Show on 1320 WILS, 1320WILS.com. When you think about hyperbaric oxygen chambers, Michael Jackson may come to mind as he had tried to use those to preserve his youth. But that rare air is becoming therapy for those with autism and brain injuries. Let's learn a little bit more about this from Dr. Al Johnson, who's a medical expert for 1320 WILS and Fox News Radio. He's a doctor of internal medicine. Dr. Johnson, good morning.
Good morning.
Tell us about hyperbaric oxygen therapy and how it's helping folks with autism and brain injuries.
Well, what hyperbaric oxygen does, normally your red blood cells is what carries oxygen to your tissues, and oxygen is the life of the cells. Without oxygen, they die or they become dysfunctional. When a person is placed in a hyperbaric chamber, they breathe 100% oxygen under pressure. That then causes the blood vessels to become saturated with oxygen. So not only the red blood cells carry oxygen, but the whole blood vessel carries oxygen to the tissue. Therefore, the tissue gets like 10 to 15 times greater concentration. Those tissues who have been injured but not dead then can get that nutrient of life, oxygen, to help revitalize those tissues and help healing. And this is the basic underlying process.
All right, tell us, let's start with autism. How does it help those who are afflicted with autism?
Well, autism is a whole spectrum of problems that may arise from kids that have had some damage to their systems. We don't know really the cause of it. Parents, because of their children not functioning right, have tried all different kinds of things. And there's some articles in the literature and reports from parents that when their kids have undergone hyperbaric oxygen treatment, it helps the brain, as we just talked about, and these kids function better. They have eye contact when they didn't have eye contact before. They quit stimming. Some of them have even gone from non-speaking to being verbal. So there needs to be more studies done, but there are positive effects from it that have been seen in that autistic spectrum community.
Now, how does it help those afflicted with brain injuries?
Well, with brain injuries, such as concussions from sports or from automobile accidents, or from the vets, like percussion injuries to the brain, studies have shown that the vets, 80% of the vets that were treated with 80 treatments with hyperbaric were able to get back to some functional use. What it does is those tissues that are damaged, they aren't dead, but they're idle. Hyperbaric oxygen helps stimulate the cells, the mitochondria in the cells, the little engines, to start working better because they're getting the appropriate nutrient, oxygen, and then you get recovery. Whether it's 100% or not depends upon the extent of injury in each individual.
How much are these treatments, and where can people go to get them when they need them?
Well, the use of hyperbaric oxygen is FDA approved for 14 indications. Many of those are diabetic wounds, acute carbon monoxide exposure, acute drowning, acute hearing loss. The rest of what we've been talking about is off-label use, which is done in all kinds of things, from medications to different devices, such as hyperbaric in the medical field. Getting it for, say, head trauma, autism, and off-label uses is done on an outpatient basis in freestanding clinics around the United States. The hospitals are only allowed to do FDA-approved treatments. The cost can vary anywhere from $150 to $250 an hour. Billings from hospitals range $1,500 an hour or so.
And I've read that you can buy these chambers for your home use for about $7,000. So you anticipate we'll be seeing this used more frequently, Dr. Johnson?
Well, it will be used more frequently. The chambers you're talking about are modified high-rescue mountain chambers that are used in the home, where you aren't breathing getting 100% oxygen inside the chamber like you do in the true hyperbaric chambers that you use for decompression sickness or they use for wound care or what the freestanding clinics have. So you're kind of talking the difference between apples and oranges with a soft-sided chamber because you don't get the pressures that the hard-sided chambers have or the amount of oxygen. But yes, those are available. The studies that have been done around the world where they treat strokes in Italy within 2 or 3 days after the stroke, those are all done in true hyperbaric chambers where they're monitored by medical personnel and patients are watched closely.
We've been talking with Dr. Al Johnson, who's a medical expert for 1320 WILS and Fox News Radio. Thanks so much, Dr. Johnson.
Oh, you're totally welcome, and have a good day.
It's the Tony Conley Morning Show and more compelling talk radio, 1320 WILS and 1320WILS.com.